Welcome to Anatomy and Physiology. This is possibly your first video here, and so the thing that I want to touch on first is anatomy versus physiology. We are going to study both, but anatomy is really looking at the structure. It is looking at the body like part, whereas physiology is looking at the functionality of said part. So this is why you see anatomy and physiology, because so often what we're talking about is not just the body part, we're talking about what the body part does. So that's the difference between those two. In anatomy and physiology, we are going to be looking at all of the organ systems to varying degrees. So I just have a little diagram here for all of those. Some of these we will combine. The respiratory system and the circulatory system I will combine into the cardiovascular system because they are so intertwined with one another in their functionality. So I will combine those when we talk about them. But each of these are things that we are going to touch on throughout the year. So let's start learning some anatomical terms. First, where do our organs reside? Well, our organs are going to be found in what you would consider an organ most of the time. There are, of course, organs that are not part of this diagram. Things like your skin, the largest organ of the body, obviously is not going to be housed in one of these cavities. Also, bones. Bones, for the most part, kind of outline cavities. And you'll kind of see what I mean once I start going through these. So I'm going to start here on the right with the dorsal cavity. The dorsal cavity is then subdivided into the cranial cavity, which houses the brain, and the spinal cavity, which houses the spinal cord. And you can start to see what I mean by having the bone surrounding the cavity. Then moving here to the left, we have the ventral cavity. The ventral cavity is on the front side of the body, whereas the dorsal cavity is on the back side. And the ventral cavity is then divided into the thoracic cavity, and most often what it gets called is the abdominal cavity, but usually what we think of the abdominal cavity is actually the abdominopelvic cavity. The thoracic and the abdominopelvic cavity are separated by the diaphragm. And then the abdominal cavity and the pelvic cavity are what make up the abdominopelvic cavity. The pelvic cavity is kind of outlined by the pelvis, what you might think of as your hip bones. The thoracic cavity is kind of outlined by our rib cage. And so you can start to see how, like, what I mean by organs kind of residing in these cavities. It's mostly our internal organs because, again, bones are an organ. And so those are actually outlining the cavities for the most part. But this kind of gives you a good idea of where we're going to find each certain thing. This is another way to divide up the body and kind of talk about how we find organs. So you might hear me talk about like the right upper quadrant or the right lower quadrant. I'm just using these as a way to direction our like movement around the body. One thing I do want to bring your attention to is on this diagram, you can see the umbilical region. That gets its name for where the umbilical cord attaches. You know where your umbilical cord attached to you because that's where your belly button is. But what we're going to spend most of our time today talking about is directional terms. And so how do we describe where something is in the body and so that everybody knows what we're talking about? That is what anatomical directional terms are all about, is making sure that everybody knows where to find a specific thing. Most of these terms are going to come in pairs. that contrast one another. So our first anatomical term, anterior. Also called the ventral side, and this is towards the front side of the body. Then we have the posterior, which is where we have the back side of the body. It's also called the dorsal. And you can see what I mean by pairs there. Then our next set, superior, so closer to the head. And then inferior, which is farther from the head or closer to the feet, you could say. Medial, which is closer to the midline of the body, versus lateral, further from the midline of the body. All of those directional terms that we just talked about focus around what we call the planes of the body. And these are imaginary lines that can divide the body in half. There's the median, which is also called the sagittal or the mid-sagittal line or plane. Then we have the frontal plane, which divides the body into front and back. We have the transverse, which is where we divide the body into top and bottom, or superior and inferior. And I want to talk a little bit about why the median has so many different names. And it has to do with the fact that sagittal just means a vertical division of the body. And so there's lots of ways you could divide the body along, like through the face. And so the mid-sagittal plane is the one that runs right along the median, which is why I choose to use the median plane when I talk about it. I will call it the median or the midline rather than the mid-sagittal, just for ease. But you can also have things like a parasagittal plane, where it's just off of the midline. So for that reason, I usually go with median. I am not really going to care which of these you choose. If you choose to call it the coronal instead of the frontal, I like frontal because I think of it as dividing the body into front and back. Transverse just makes more sense to me, but if the horizontal plane makes more sense to you, as long as you're using one of those terms so that we have a shared vocabulary that we're using, I don't care which one you stick in your brain and actually remember. So we also have axial, which is the center part of the body, the torso and the skull. But we also have appendicular, which is a part of the appendages or the limbs. Those would be your legs and your arms. We also have proximal and distal. Proximal is where we are closer to that axial portion, closer to the trunk of the body, the torso and the skull. Distal is further away from the trunk. These are terms that you really only exclusively use on appendages, on limbs. So you would really only use these when you were talking about a leg or an arm. Superficial means it's closer to the surface of the body, which means it's closer to the skin. So if something is superficial, it's probably either on the skin or directly underneath the skin. Versus deep, which means it's really far away from the skin. It's really on the interior part of the body. This is usually something we use to describe wounds. Like a superficial wound would be one that, barely cuts through the skin, whereas deep could cut through muscle tissue or down into like an organ if it was on our axial part of the body. So here is just showing you those, and I pulled this image in as well to kind of discuss that idea of these are all terms that are opposites of each other, kind of focused around these planes that are used to divide the body. So like superior and inferior are the two sides of the horizontal or transverse plane. Left and right are the two sides of the medial plane, the median. Medial and lateral is how far or close to the midline we are. Proximal and distal are really only the exceptions there. We also have anterior and posterior, the two sides of the coronal plane. So thinking of it as the front and back side. So anterior versus posterior for the coronal. So I just wanted to kind of compare and contrast these for you so you could kind of get an image in your head of what these are. Make sure you take time to label your outlines. So draw in those planes on your human body outlines and then label each side of that plane with the appropriate term. And then finally, this should be review. This is something that you should have seen in freshman biology. So you should be familiar with the levels of organization. And so we have the chemical level, we have molecules, then we're going to have the organelle level, and then the cellular level, then we're going to have tissues, and then we're going to have organs, organ systems, and organismal level, the human level. And that will wrap up our anatomical terms.